Hey everyone, welcome to part 6 now of our online lectures. So we covered the 4 modules from chapter 15 and now we're on the second module of chapter 16. It is late and I am tired, so I apologize in advance if any of this sounds ridiculous. And it's a pretty long slideshow, so I'm going to try to get through it as quickly as I can. What we're going to focus on this class is talking about the different types of therapies that can be used to help treat mental illness. So module 16.2 is psychological therapies. Psychological therapies, in module 1 we discussed some barriers to accessing psychological therapy and how we might possibly evaluate different therapeutic approaches. So psychological therapy is a very broad term and there are many different therapeutic approaches for practitioners to choose from. So in this module we're going to study several of those approaches. So we'll talk a bit about insight therapies, which include kind of Freud's psychoanalysis and those psychodynamic theories. We'll talk about some behavioral therapies, some cognitive therapies, and some that kind of blend the two and blend in some mindfulness and meditation and things like that. So insight therapies, basically it's a general term referring to therapy that involves dialogue between the client and the therapist for the purpose of gaining awareness and understanding of psychological problems and conflicts. So basically what's happening is they think that through talking to the client, about their past and, what's been going on with them, they'll be able to uncover what is actually kind of underlying the psychological problems they might be having. And then once they identify what's kind of the root of the problem, they're able to kind of try to attack it and solve it. So the formal beginning of insight therapy came with Freud's development of psychoanalysis and its evolution into psychodynamic therapies. So psychodynamic therapies are forms of insight therapy that emphasize the need to discover and resolve unconscious conflicts. So not all insight therapies focus on the unconscious, but anything psychodynamic, psychoanalytic is going to be focusing on the unconscious and kind of stems from Freud's viewpoint that all of the issues that we have and the troubles we deal with kind of stem from our unconscious motives and desires. So psychoanalysis sprang out of Freud's understanding, and I say understanding kind of with air quotes because I don't know how well he understood it, but what he felt he understood about consciousness. And Freud and his followers based their practice on some core ideas as summarized in table 16.1. Obviously, it can be quite difficult to access the unconscious, so Freud and his followers invented several methods, 4 of which have been particularly important in the practice of therapy. So we'll talk a bit about those in a minute, but for now, just to go over some of the core ideas that form the basis of psychoanalysis. Essentially, Freud and his followers believe that all adult psychological conflicts have their origins in early experiences, so any issues you are currently dealing with can be traced back to your childhood. These conflicts affect the thoughts and emotions of the individual, and their source often remains outside of conscious awareness. So again, a really big thing with Freud is he's all about the unconscious and how things that we're not quite consciously aware of can have a major impact on our behavior and our thoughts and things like that. He called these unconscious conflicts neuroses, also known as kind of anxieties. So by accessing the unconscious mind, the analyst and the client can gain a better understanding of the early conflicts that led to the neurosis. So basically, we're going to look at the past and see what you did in the past and figure out how those experiences might be affecting your kind of unconscious conflicts that still exist in the present. And so by understanding where they came from, we can identify them and hopefully solve them. So once the conflicts are brought to the surface, the analyst and the client can work through them together. So 4 of the major techniques from psychoanalysis include free association, which is basically encouraging your client to just talk and talk and talk, or write and write and write, without censoring them whatsoever. It's kind of almost verbal diarrhea in a way. You basically just want them to tell you whatever pops into their mind, without censoring themselves in any way, and Freud believed that this uncensored content would reveal clues to the unconscious. So if you just let them talk and talk and talk, eventually, and all you do is listen, eventually they're going to say something that will give you a clue as to what's going on beneath the surface. The second is dream analysis, and I talked about this a bit when we talked about the consciousness chapter, but Freud was one of the original proponents of dream analysis. So he basically figured that we could examine the details of a dream, both which is the manifest content, so what's actually occurring in the dream, in order to gain insight into the true meaning of the dream, which is the emotional unconscious material that is being communicated symbolically, aka the latent content. So for example, there's a kind of silly story in the text, and I like this one because obviously I have dachshunds myself, but I thought it was really cute because it's talking about a man who was one of Freud's clients, and he kept having this dream where he was riding a bicycle, and all of a sudden a dachshund comes up and starts like nipping at his ankles and trying to kind of bite his ankles. And then there are these two elderly ladies that are kind of over watching him and laughing. And so that would be the manifest content, what's actually occurring in the dream. And so Freud figured that basically he was having this dream because his client had mentioned on several occasions there was a lady that he used to see walking her dog, and he wanted to ask her out, but he was too afraid. So essentially he was planning on using her dog as an excuse to talk to her. And so basically Freud said that his anxiety about rejection, about asking the girl out and becoming rejected, essentially manifested itself in his dream as that dream of being chased by the dachshund and having people laugh at him. So the latent content, the symbolic content, was his anxiety over asking the girl on a date, but the manifest content was the actual kind of dachshund chasing him and the women laughing. So kind of silly stuff. Again, we talked about dream analysis. It's not something you can standardize or validate empirically whatsoever, but it is still a technique that was really influential in terms of the early days of psychoanalysis and psychodynamic therapy. So then we have resistance, which is engaging in strategies that keep information from fully manifesting in conscious awareness. So for example, kind of trying to deflect from serious conversations by using humor, maybe skipping sessions with your therapist. Basically, a psychoanalyst views resistance as a promising signal that unconscious motives will be revealed. So the more the client begins to pull away from the therapist, that's basically interpreted as they're getting close to something. They're getting close to uncovering those unconscious motives and desires. So it's actually seen as a good thing when the client starts kind of skipping out on sessions or maybe kind of acting defensively towards their therapist, because that means they're close to making a breakthrough. And then finally, the fourth technique is transference. And so this is when clients direct certain patterns or emotional experiences towards the therapist rather than the original person involved in the experience. So for example, their parents, because again, like we said, Freud thought that all of your issues stem from your childhood experiences, and a lot of that had to do with your parents and their parenting style. So for example, if you felt like you were heavily criticized by your mother growing up, then that might transfer into you feeling like your therapist is being overly critical of you. And so again, transference, just like with the resistance, is said to be a significant milestone in the process of psychotherapy, because it essentially tells you, by transferring those feelings onto the therapist is able to identify what the feelings are and what the issues are. And by kind of solving the mystery of what those unconscious motives and desires and conflicts are, then you're able to begin working through them. Again, this is all according to Freud and all the psychoanalysts. A lot of it is, like I said, not empirically validated or really supported, but it's still something that a lot of people buy into, and a lot of people do use some of these techniques, at least to some extent, in their therapy. So these are just some of the tools used by psychoanalysts in their attempt to access the unconscious. Basically, once the material is brought to light, then the patterns can begin to be examined and ideally changed. So they're looking to identify the unconscious issues so that they can then examine them and attempt to change them in some way. And I guess stop them from being disordered. So in terms of modern psychodynamic therapies, I don't want to talk about this a lot, but it was in the textbook, and the object relations therapy is a pretty big thing, so I just want to mention it here. So Freudian-based psychoanalysis is used by relatively few therapists today. There are very few people who are actually using kind of full-on Freudian-style psychoanalysis. However, there are several new therapies that have evolved from traditional psychoanalysis, but they tend to be more concerned with conscious experience and are generally more optimistic. So one such therapy is known as objects relation therapy, which is a variation of psychodynamic therapy that focuses on how early childhood experiences, so again, it's still psychodynamic, we're still looking at those early childhood experiences, and emotional attachments influence later psychological functioning. So the objects in this object relations therapy are the client's mental representations of themselves and the important others in their lives. So basically what this theory is saying, this therapy is saying, is that a lot of the issues are going to stem from the fact that you haven't quite been able to forge those strong relationships between yourselves and important others in your childhood or in your early years. And so the fact that you weren't able to form those kind of strong and secure attachments to those others, to those objects in your life, is what is causing you problems in the present. So again, not something you really need to worry about too much, but just wanted to point it out here because it is something that's been pretty influential. So, with respect to humanistic existential psychotherapy, in the 1950s, humanistic psychologists broke from psychoanalytical approaches over several deep differences in their assumptions. So, humanistic psychology has always been kind of a little bit more positive, choosing to focus on the strengths that people have, and so eventually it broke off completely from psychoanalytical and psychodynamic approaches. So you can see some of the key differences listed here in Table 16.2. So whereas psychoanalysis focuses on unconscious drives, humanistic therapy focuses on our conscious experience. Psychoanalysis is basically saying that the things we do and the way we act and what we believe is determined by our repressed sexual and aggressive instincts. So basically it's saying that we don't really have a choice there, it's more determinism, whereas humanistic therapy is more about behavior being chosen freely and the fact that we as humans have free will. Psychoanalysis chooses to focus more on the neuroses or the weaknesses that we might have, whereas humanistic therapy focuses more on the strengths and how we can use those to our advantage. In terms of responsibility for change, psychoanalysis, the analyst interprets and explains to the client what is wrong. So basically they listen to the client, they interpret what the client's saying, and they tell the client what it is that's wrong. Whereas with humanistic therapy, the therapist asks the client what is wrong and attempts to help clarify those issues. And then finally, the mechanism of change. So in psychoanalysis, we're hoping that insight into unconscious conflicts allows problems to be worked through. Whereas with humanistic therapy, unconditional positive regard allows a person to heal and become more authentically themselves. So it's more about treating someone kindly and with that unconditional kind of respect and, caring for them so that they can kind of be nurtured and grow from their experience, rather than focusing on the negatives and trying to eliminate them. When we talk about existential psychotherapy, humanistic and existential therapies share many similarities. So they both want to help people become their authentic selves. They want to help people become more loving and help people take responsibility for their actions and their behaviors. So the major difference when we're talking about humanistic versus existential psychotherapy is that humanist therapists focus on removing impediments to self-actualization. So we're trying to allow people to be the best person they can be by removing things that might be getting in their way. While existential therapists emphasize the importance of facing painful experiences. So basically, we're not removing the negatives, we're facing them. So existential therapists believe that in order to self-actualize, to become the best person you could be, you need to face your fears in order to be able to kind of deal with them. So these therapies both employ a phenomenological approach, which basically means the therapist addresses the client's feelings and thoughts as they unfold in the present moment, rather than looking for unconscious motives or dwelling in the past. So very, very different from psychodynamic and psychoanalysis and their focus on the past and on the unconscious motives and desires. This one is looking at the here and now and how things are happening right now and how we can work to make them better and improve outcomes. So an American psychologist named Carl Rogers developed a version of humanistic therapy that he called client-centered therapy, also known as person-centered therapy, which basically focuses on an individual's abilities to solve their own problems and reach their full potential with the encouragement of the therapist. So again, when we're talking about humanistic therapy, it's all about helping people self-actualize and kind of reach that highest point and be the best person that they could be. So Rogers believed that all individuals could develop and reach their full potential, and that psychological problems stem from what he called conditions of worth. Basically what that means is that if you have conditions of worth placed on you, it means that there are, say if you have a parent and they only show affection to you if you get good grades or you do what they want you to do, that would be considered a condition of worth. So you are only worth something to me if you do as I say, if you act the right way and say the right things. And so obviously conditions of worth can be very damaging, because if people internalize them, they feel like they're not actually worth anything unless they do certain things and they act a certain way and they believe certain things. So obviously having those conditions of worth placed on you, especially if it's by a parent or by, someone that you admire and look up to, that's going to be very detrimental to your mental health. So emotion-focused therapy is one promising type of person-centered therapy. It's a newer type, and it is based on the well-supported belief that it is better to face and accept difficult emotions and thoughts rather than bottle them inside. So we all by now, we're probably aware of the fact that people say, don't bottle things up, let your emotions out, and that's exactly basically what the focus of emotion-focused therapy is, trying to actually kind of bring those emotions to the forefront and acknowledge them and deal with them, rather than just bottling them up until you explode. So the most important aspect of these types of therapies, the client-centered or person-centered therapy, lies within the therapeutic alliance. So the key thing when we're talking about humanistic therapies, especially when we're talking about the client-centered therapy, is what we call unconditional positive regard. So no judgments, you can talk to your therapist, tell them anything that's on your mind, and they come at it from a perspective of, still caring about you, and still respecting you even if they disagree with you. So having that unconditional positive regard is very, very important in terms of helping people heal and helping them gain kind of self-confidence and become the best person that they can be. So that's a major part of that therapeutic alliance between the practitioner and the client. So in terms of evaluating our insight therapies, we are going to talk a bit in each section in this module about evaluating the different types of therapies, as we did talk last module about whether or not we're able to evaluate therapies, but we'll talk at least a little bit about what the research has kind of told us on some of these therapies so far. So ultimately, it seems that the effectiveness of insight therapy depends on the condition being treated. So studies have shown that psychodynamic therapy is not effective in treating severe depression or schizophrenia, but it may help with panic disorder, dependence on drugs, and borderline personality disorder. So even though psychodynamic therapy is a little out to lunch in a few ways, it does have some success with certain types of clients, and it is still practiced by certain practitioners, or at least they use aspects of it in their practice. So for less severe conditions such as mild depression and anxiety, we've seen that insight-focused therapies can often make a difference by helping individuals gain understanding and awareness of the nature of their psychological problems. So all of these insight therapies, whether we're talking about psychodynamic or humanistic existential therapies, some are focusing on the unconscious, some are focusing on the conscious, but they're all about trying to really identify what the issue is, where it arose from. And they feel that by identifying where those issues came from and what they are, you're better able to deal with them. And so research has actually also shown that Carl Rogers, who we just talked about, was accurate in emphasizing the importance of the therapeutic alliance. So it has been shown by research that a strong alliance is a good predictor of successful therapy over and above the specific type of therapy. So it's not as important what specific type of therapy that you're engaging in. It's more important that you have that really strong bond between kind of the client and the therapist, where they feel like they can trust you and they can work with you. And it has been shown that person-centered therapies are reliably found to be more effective than no treatment. So there's varying kind of results when we talk about how successful they are for person-centered therapies. Some say they're not really more successful than placebo. Others say that they're just as successful as cognitive behavioral therapy, which we'll talk about in a bit. But the fact remains that they're definitely better than nothing. So overall, some of the insight therapies and some of the techniques that we just talked about have been very successful in a therapeutic setting. Now we're going to move on to behavioral therapies. So behavioral therapy is kind of the opposite side of the map. They are therapies that attempt to directly address problem behaviors and the environmental factors that trigger them. So we talked about, learning and conditioning way back in chapter 6, and we talked about how people, kind of acquire behaviors through reinforcement, or they might kind of stop behaving in a certain way due to punishment. We know that you can have associations between two things, which can, for example, classical conditioning can result in fear conditioning in a lot of cases, which we talked about. And so behavioral therapies operate on the belief that patterns of behavior are the result of conditioning and learning that has led to maladaptive habits. So the reason we have these maladaptive habits and thoughts and things like that is because of conditioning. And so therefore, to treat disorder, we must seek to recondition our clients. So kind of like when we talked about counter conditioning way back in chapter 6, that is something that's kind of used here when we're talking about behavioral therapies, especially when we're trying to eliminate phobias. So a very common behavioral technique used to treat phobias is systematic desensitization, which is basically gradually exposing somebody to their feared stimulus or situation while coupling that exposure with relaxation training. So what you're going to do is you're going to create what's known as kind of a fear hierarchy, which kind of lists step by step things that you can do to kind of get you closer and closer to that feared object or feared situation. I kind of think of it in a way kind of like shaping, how we talked about shaping a behavior by reinforcing those successive approximations towards the behavior. This is kind of similar, but we're basically working them up step by step to confronting their fear. In some cases, clients may undergo a process known as flooding, which is, in my mind, probably not super effective the majority of the time, but that is basically just throwing somebody straight into the most challenging part of the fear hierarchy. So, for example, if somebody has a phobia of spiders, you're going to put them in a room with spiders. And so, obviously, that's going to be very traumatic for them, but if they are able to kind of cope and get through that situation, and they can recognize that nothing bad has occurred as a result of it, it can be effective in helping them kind of just get over it. And again, I'm kind of using air quotes there. But typically, it's done in a more kind of systematic way with, slowly, gradually building up to the stimulus or situation that you have a phobia of. We can also do kind of the opposite of flooding. So sometimes people are so phobic of something that they can't even stand to kind of engage in the first step of that fear hierarchy. So sometimes they will watch others engage in those activities or kind of engage in kind of the steps of that hierarchy. And so by watching others, it's kind of observational learning, modeling, like again we talked about in the chapter on learning, but basically by watching somebody else kind of confront their fear and get over it and not really have a negative consequence, that can help you learn that maybe it's not so bad, and it can kind of help even bridge the gap between, where you are now and that first step of the fear hierarchy. There's also a big section here in your textbook on VR therapy, which is super interesting. It's with, increase in technology, it's become really common that people use technology in these therapies, and so VR has allowed us to basically put people in situations that are very, very realistic, and can kind of model their feared situation or their feared stimulus. So you're keeping them in a completely safe environment where they're not actually being exposed, but it can feel very, very realistic. And it's been really helpful in treating military personnel who have PTSD and things like that, because they can actually simulate war zones. And the difference between that and kind of actual exposure is that the therapist has complete control over what's occurring in the VR setting. So it's a lot less risky, I guess, than actually exposing them to some of these things that you couldn't really expose people to again. So I didn't put VR therapy in the notes, but I just wanted to mention it because I think it's kind of a cool application of something, technology, and how we can use it to help out with these types of techniques. So here in table 16.3, it's basically just kind of showing you the steps of systematic desensitization. So the very first step is, of course, build that fear hierarchy, that anxiety hierarchy. You need to think about what is the least threatening way that you could kind of come into contact with that fear stimulus, and working your way up from there. So the first thing, if you're, for example, have a fear of public speaking, which is what this kind of goes through, you might just think about the presentation topic. Then you might write down ideas and do research. So you're not even getting close to actually speaking in front of anyone. It's just the actual prep work. And even that, in somebody who's extremely phobic of public speaking, can cause a lot of anxiety. So what you're doing is you're gradually working your way up, practicing the presentation alone, then with friends, then going to campus, going to the classroom, and slowly but surely you're actually getting up to the point of delivering that speech to an audience. So you create this anxiety hierarchy, but then before you even begin, you're basically taught relaxation training techniques, which is kind of step number 2 here in this table. So during the relaxation training phase, you're going to get the client to learn to respond to relaxation suggestions from the therapist as they begin to work through the hierarchy. So it's typically done using mental imagery while the client is visiting the therapist's office. Sometimes they might use actual props, but it's basically getting them to think about the things that are in their hierarchy and at each step of the way kind of calm themselves. So you're basically creating the opposite, the incompatible response to fear. And again, we talked about this with counter conditioning way back in chapter 6, but basically that's exactly what you're doing here. You're counter conditioning them. You're making them be exposed to that feared stimulus, but then at the same time making them relax, which is an incompatible response to fear. So we're hoping that the relaxation will override the fear and eventually they'll be able to kind of face their fear. And so once you've gotten some training kind of in relaxation, then you're going to move on to step 3, which is when you're actually working through the hierarchy. So from least to most scary part, you're going to kind of work through it step by step. So now we're going to talk just briefly about aversive conditioning. So sometimes behavioral therapy may focus on trying to reduce or eliminate an undesirable behavior, such as smoking or biting your fingernails. So it could be anything that you're trying to kind of eliminate in terms of a behavior, but basically what we're doing, just like again back in the learning chapter when we talked about aversions and how you can kind of develop a taste aversion through, pairing a food with something that tastes really bad. Aversive conditioning is literally using that kind of on purpose. So it's a behavioral technique that involves replacing a positive response to a stimulus with a negative response, typically by using some form of punishment. So for example, there's a drug known as antabuse, and it is used to help people who are alcoholics or problem drinkers, because basically what it does is when this chemical interacts with alcohol, it causes really severe nausea and undesirable symptoms. So basically, the person is tasked with taking the medication, and then if they do drink, they get really sick, and that kind of helps create that aversion to drinking and hopefully lessens that behavior. So aversive conditioning can be very effective, but obviously even just listening to what I just said, it requires a lot of willpower to implement correctly. So you need to have somebody who's committed to making that change, because they have to be responsible enough to actually take the medicine knowing that it could make them very sick if they end up slipping up and drinking. So it definitely requires a lot of willpower on the behalf of the client, and it has to be something that they are committed to changing. Now we get to talk about cognitive behavioral therapies. So what we just talked about was kind of strict behaviorism. Cognitive behavioral therapy is one of the most popular and the most effective types of therapy out there. There's a lot to it, so we're going to kind of break it down a little bit here and talk a bit about the cognitive side, a bit about the behavioral side, and a bit about where cognitive behavioral therapy came from. You may have heard CBT. That's what we're talking about, is cognitive behavioral therapy. So behavioral therapies, they may be effective at changing problematic behaviors. Obviously, if you're using conditioning principles, you may be able to, lessen a behavior, but they don't directly address problematic thoughts. They're not really doing much about our thought patterns. And many disorders, such as depression, are caused and maintained, at least in part, by dysfunctional habits of thinking. So a lot of the time when we're talking about mental disorders, it's just that, it's mental. There's a lot of it that's kind of in your head and in your thoughts, and if we're not addressing those problematic thought patterns, then we're not getting to the root of the issue. So Albert Ellis and Aaron Beck, who were originally trained psychodynamically, found that people with depression tend to interpret and think about their lives in a negative light. So Basically, people who are depressed tend to make more internal attributions for negative events, so they blame it on themselves as a person, something that was inherent to them. They tend to make more stable attributions for negative events in saying that, this is something that's going to continue happening, bad things are always going to happen to me, and they tend to make more global attributions for negative events. So they tend to say, if one thing goes wrong, everything is going to go wrong, and always my whole life is a mess, right? So they're making it about themselves, they're making it into something that is going to persist and they can't get away from, and they're making it into something that's affecting all areas of their lives. And that, again, has a lot to do with thought processes. So it became apparent that therapy should be directed at changing negative cognitions into more realistic and rational ones. So changing behavior is great, and it's a really important step, but if we don't also change the thought patterns, we're not going to get very far in terms of treating mental illness. So cognitive behavioral therapy is a form of therapy that consists of procedures such as cognitive restructuring, stress inoculation training, and exposing people to experiences that they may have a tendency to avoid, which is basically like we just talked about with systematic desensitization. Helping clients to face negativity allows them to gain insight into their feelings and to learn methods for coping when negativity arises. So by helping people kind of confront those negative thoughts, kind of bring them to the forefront and challenge them in some way, that can help them better deal with those threats, those threatening thoughts, kind of if they arise at a later date. So this type of therapy is far more about the present than about the past. So that's one way in which it differs dramatically from psychodynamic therapy. And again, it's interesting because Beck and Ellis were originally psychodynamically trained, but now Aaron Beck is known as basically the father of cognitive behavioral therapy. So clearly he really kind of switched gears there. So we're really focusing on the present. Cognitive behavioral therapists help clients become more aware of the thought, emotion, and behavior patterns that arise in their current lives. So we're looking at what's happening in the present. The behavioral side of CBT involves exercises and guidance in gaining skills that clients may be lacking. So for example, in order for systematic desensitization to work, we obviously need to teach people about relaxation techniques and kind of help them establish those desirable responses. If we were talking about treating someone with social anxiety disorder, we would want to help them probably by teaching them some social skills that might help out in certain circumstances. So the behavioral side is more about actually helping them kind of gain the skills that they may need. Behaviors. The cognitive side of CBT involves exercises and strategies to build more functional cognitive habits. So as the clients become more aware of the negative beliefs, they're able to question or dispute them, which helps them in seeing those beliefs as unrealistic. So the more aware we can be of our irrational thoughts and the more we can look at them kind of and identify why they are irrational, the better able we are to deal with them and kind of see them as irrational, see them as unrealistic. So this is just an example of applying cognitive behavioral therapy to the cognitive symptoms of depression. So I just talked about these three types of attributions. The fact that they tend to make internal, stable, and global attributions for negative events. So blame oneself, assume that situations are permanent, and assume that they are going to apply to all aspects of life. So we have kind of an example of a CBT coping strategy that goes along with each of those types of attributions. So when we're talking about internal attributions, the fact that a lot of people who are depressed tend to blame themselves excessively for negative things that happen. An example of a CBT coping strategy is to challenge those beliefs. It can't be all due to who you are. Kind of try to examine the situation and see, not only the role that the person contributed to the problem, but also examining the role of other contextual factors, such as the situation, the behavior of other people. It's not all your fault. It wasn't all internal. There were a lot of serious situational factors at play as well. So we're challenging, again, those kind of negative attributions. With the stable attribution, so if you're assuming that, everything's always going to be bad and these situations are permanent and irreversible, an example of a CBT coping strategy would be basically trying to highlight the temporary nature of a person's difficulties. So again, challenging the fact that they think bad things are always going to happen, saying, you know what, there were things that were true in the past that are no longer the case. So therefore, you might think today that everything's always going to be bad, but, let's look at past history, and that's not usually the way things go. So again, trying to challenge and show them just how irrational those stable attributions are. And then finally with the global attributions, so assuming that basically, you know, if negative things occur to them, that it's going to affect all areas of their lives. The example of the coping strategy for that would be to challenge the person to explain exactly how the effects of one negative event will spill over into other parts of their life. So you're basically saying, okay, you know, you think it's going to affect everything. Well, how? How is that possible? And kind of, again, challenging the fact that they believe it's going to impact everything by making them talk through it rationally, and understand that a lot of the arguments and the thoughts that they're having are illogical. And you can also help provide examples of situations when the spillover did not occur. So again, showing them, not only challenging that belief, but also showing them examples specifically of when that belief didn't hold true. So you can really see how CBT kind of blends both the behavioral aspects and the cognitive aspects of therapy. And it's, in my mind, one of the best types of therapy that we have to date. And you'll see just based on the results of research that it has been shown to be one of the most effective therapies out there. So now we're going to talk briefly about mindfulness-based cognitive therapy. I will admit, mindfulness is not something that I'm into personally, but that does not mean it doesn't work for a lot of people. So I'm going to talk to you a bit about what the textbook says. And basically, when we're talking about mindfulness-based cognitive therapy, we're saying that now we're able to take the traditional CBT that we just talked about and blend it with meditation-based practices, such as mindfulness. So in order to treat our clients, not only can we use those traditional techniques, but we can also kind of have them engage in mindfulness exercises and things like that that might further help them in the recovery. So if you look at it, the goal of both mindfulness and CBT is to get the client better acquainted with their own thoughts and feelings. So CBT says, you know what, we need to find those irrational thoughts, we need to challenge them, we need to fix them. The major difference between CBT and mindfulness, even though they're both working on getting the person acquainted with those thoughts and feelings, mindfulness involves basically adopting an orientation of accepting oneself. So it makes no claims about you having to actually confront and kind of eliminate those irrational thoughts. It's more about being in the moment, kind of understanding your thoughts, being able to kind of acknowledge that they exist, but also to kind of let them go. So basically they say in mindfulness, you must consciously choose over and over to take an attitude of openness and acceptance toward yourself. So it's understanding that you have those thoughts that may be irrational and maybe negative, but still being open and accepting toward yourself. And, you know, making sure that you know that having those types of thoughts doesn't make you any less of a person. And so it's basically, it's got a lot to do with kind of optimism and focusing on the positives. And so Dr. Daniel Siegel described the attitude of having kind of that openness and acceptance toward yourself as coal. So being curious, being open, being accepting, and being loving towards yourself. Mindfulness often affects a person through decentering, so that's a really important technique in mindfulness, which is when a person is able to step back from their normal consciousness and examine themselves more objectively as an observer. So it's almost, not quite, but it almost kind of, you can liken it to like an out-of-body experience. You're kind of able to view yourself objectively kind of from the outside. And so this can be a very powerful antidote to difficult thoughts and feelings because it may allow you to detach from the damaging consequences. So being able to acknowledge that you have negative thoughts and maybe negative things occurring, but being able to kind of detach yourself from them so that you're not as affected by the negative consequences of those thoughts and feelings. So mindfulness-based cognitive therapy, or MBCT, involves combining mindfulness meditation with standard cognitive behavioral therapy tools. So far I was just talking about kind of what mindfulness is, but the actual mindfulness-based cognitive therapy is combining CBT tools with that mindfulness meditation. It has been shown to have powerful effects on people who have experienced a major depressive episode. So we do see certain studies have shown a substantially reduced likelihood of relapse for people who have a major depressive episode and engage in MBCT. And it seems to have great promise as a therapy for many different conditions. So it's been known to help with some anxiety disorders, such as social anxiety, with bipolar disorder, with hypochondriasis, which is basically someone who's a hypochondriac. They kind of constantly think they're going to get sick, and with suicidal ideation. So MBCT, whether personally I like mindfulness or not, still has been shown to be very promising in terms of treating a bunch of different types of disorders. I'm not sure really if it's been illustrated how much more effective it would be kind of compared to just standard cognitive behavioral therapy, but it definitely, doesn't seem to hurt, and it does seem to help a lot of people, especially if you are a person who's more inclined towards those types of things, the meditation and mindfulness practice. We're going to talk very briefly about group and family therapies. So some clients may benefit from participating in group therapy sessions. So if you are in group therapy and you're in a room full of people who are going through the same thing you are, it can be really helpful in terms of the bonding and support that can occur. It can be very powerful in terms of helping you recover and having somebody to kind of lean on. Other clients require family therapy. So typically this occurs if, one, the client's difficulties stem from or are reinforced by unhealthy dynamics within the family. So if the family is kind of part of the issue, or two, on kind of the other side, to help families deal with specific family members who are highly dysfunctional in some way. So you might be treating, the family as a whole if you feel that they might be responsible for the issues that your client is going through, or you might be if it is their issues are affecting the family in some way and you're trying to kind of help out the family members in that case. So in either case, family therapists generally take what we call a systems approach. It's an orientation that encourages therapists to see an individual symptom as being influenced by many interacting systems, which, is pretty straightforward. So we're talking here about the family system for the most part, because looking at the dynamics kind of within those systems, such as a family system, they can play a big role in the development and maintenance of psychological disorders. So family therapists, group therapists, they can use pretty much any of the techniques we've already talked about, but they are going to be generally taking that systems approach in terms of they're not treating the individual simply as the individual. They're seeing their symptoms within the context of the different relationships that they are a part of. And that's all I have to say about group and family therapy. It's not, not something to really worry about too much. In terms of evaluating our cognitive behavioral therapies, so obviously we still want to know that they are going to be effective. So behavioral therapies have been shown to be particularly effective at treating symptoms of anxiety disorders, such as OCD and specific phobias. So obviously when we talked about, systematic desensitization, which is a type of behavioral therapy, it is obviously very effective in terms of treating phobias through kind of establishing that fear hierarchy and kind of facing your fears. So that's just kind of behavioral therapies alone. Cognitive behavioral therapies have been quite effective in treating depression, as well as conditions such as anxiety, obesity, and eating disorders. CBT is actually known as the most effective treatment currently available for anxiety disorders. It actually literally even outperforms long-term kind of anxiety medication use, and the effects persist longer. So again, that's not for everyone. It's not to say it's going to work for every single person, but it has been shown that cognitive behavioral therapy is, basically your best bet against certain disorders, and it's been shown as being really highly effective in terms of a lot of different types of disorders. Definitely kind of the most, it seems, versatile approach that we see in terms of the types of disorders. So cognitive and behavioral therapies are quite versatile in their applications. They take much less time and are less expensive, obviously if they're taking less time, less sessions, than psychodynamic approaches, and have none of the undesirable side effects of drug treatments. So really, there's a lot of benefits there. Again, it's not going to work for everybody. It's important to keep in mind that different treatments work best for different people. But if I were to say, what is generally the most effective therapy out there, I would probably point to CBT. And psychodynamic, this is an interesting point that isn't really talked about in this textbook, but psychodynamic approaches, literally sometimes those relationships, those kind of sessions will last for years. you have to keep going back to the therapist over and over again, because they literally are just waiting for you to somehow unveil your unconscious to them, and that can take a lot of time. Whereas with, cognitive behavioral therapies, typically you're going to try to limit the amount of sessions. Like there should be, 10, 15, 20 sessions, and hopefully the majority of the issue would be dealt with. And then, of course, you could probably go back every now and then, kind of like maintenance, but it's not expected to be that super long-term lasting therapeutic relationship that you'd see in psychodynamic therapies, psychoanalysis. So again, important to keep in mind, the bottom line is that different treatments work best for different people. But now you have a little bit of information on the different types of treatments, and you kind of know a bit more about what they're about and what they entail. So if you or someone is having an issue with some kind of psychological disorder, then at least now you kind of know what the options are, and you're able to kind of compare them a little bit. Which leads me to our final point in this chapter, which is this table. Sorry, not in the chapter, in the module, I guess I should say. We still have one module left, but hopefully it won't be nearly as long as this one, because this has been my longest video yet. So in terms of this little module summary, I just thought it was really nice to include. It's got some pros and cons of the major types of therapy. So we talk about our insight therapies, which would be the psychodynamic, the humanist therapies we talked about at the beginning. They can help in terms of understanding yourself and facilitating personal growth, but they tend to involve long-term therapy and can have limited application to people with serious disorders. Helping somebody self-actualize and be a great person is good and all. It might help with, depression and, anxiety and some kind of more milder cases of certain syndromes, but it's not going to help someone with schizophrenia. So insight therapies, they have a limited application in terms of what they can help treat. Behavioral and cognitive therapies, they tend to be time and cost efficient. They address both the immediate thoughts and the behavioral problems, and they can address both mild and severe problems. You can treat somebody with a super severe specific phobia using behavioral treatments. So they are, again, considered one of the better, but they still have their cons. They do not necessarily offer deeper understanding of your psychological problems, because obviously psychodynamic, psychotherapies and psychoanalysis, you're kind of trying to look back into someone's past to understand why they are the way they are. CBT doesn't do that. They don't care as much about your past and the things that you've been through. And so it's not necessarily going to offer you, if you're looking for somebody to explain you to yourself, CBT is not going to do that. And unfortunately, when used alone, it may not be effective for some severe cases in certain disorders. So again, a lot of the therapies aren't really going to be super effective in treating schizophrenia. It is, one of the trickiest mental illnesses to deal with, but definitely CBT has been shown to have positive outcomes for some more serious issues than, say, the insight therapies have. And then finally, group and family therapies. And again, you could be using any of the other types there, any of the techniques from insight or behavioral and cognitive therapies. But basically, their major advantages are they're allowing people to emphasize and relate to others with similar problems in terms of the group therapy. In the family therapy, it gives family members insight into how each individual contributes to the aspects of family life. And it can help change the larger social dynamics that reinforce and maintain the disorder. So if you were treating someone with, say, an eating disorder, and a lot of their issues and kind of the reason they developed that disorder had a lot to do with, say, their parents being very strict with them and wanting them to be perfect and that kind of thing. You can treat the person for the disorder and try to help them out in terms of changing their own thought patterns. But if then you let them go back into that family and the family hasn't changed their attitudes then that have contributed to that disorder, then you might still kind of see relapses and more negative outcomes. So group and family therapies, or family therapies, I guess I should say, can change the larger social dynamics that reinforce and maintain the disorder and kind of ensure that there's less likelihood of a relapse, because we're hopefully addressing all kind of contributing factors to the issue. But the cons to group and family therapies, they don't fully address individual issues. Although when you think about it, like a lot of the time group and family therapies are used in combination with individualized therapy. So again, in the example I just gave about eating disorder, if you had a client you were working with because, they were suffering from an eating disorder, you would probably still be working with them one-on-one, but you would also want to have kind of their family involved to try to help address maybe some negative dynamics within the family as well. So, there's pros and cons to all of these. Again, the group and family therapies are not so much a type of therapy as they are kind of a model of therapy. They can use any of the other techniques, but it's definitely interesting to look at kind of the positive and negatives of each. And I'm going to stop now because I'm at 49 minutes and our class is 50 minutes long, so I am going to cut this down to the wire. If you have any questions, let me know, and I will be online tomorrow morning for class if you want to come and chat with me. Have a great week, everyone. I will see you soon with the last video.